Nehawu has decided to suspend its strike action over wages. This after reaching an in-principle settlement with government over its members' pay for 2022. Government has also increased its pay rise offer from 4.7% to 7% for the 2023 to 2024 year. Let's get more details about these negotiations from Nehawu's Deputy General Secretary, December Mavuso. Mr. Mavuso, good morning and thank you very much for your time. Perhaps talk us through what has been agreed upon in principle.
Yeah, good morning and good morning to the listeners. It's correct that we have called off the strike following the signing of the settlement agreement between us and government, the unions that were in dispute. Now, the agreement paves the way for us to finalize the residual issues emanating from the 2022 dispute. You remember that we're arguing that the government should not have imposed the 3% and can't decide alone what is good for workers, and they've been refusing to engage. So we have now agreed that that matter must be reopened and must be discussed as part of the current wage negotiations for 2023-24.
Okay.
Secondly, we have now agreed that it's about time the issue of minimum service level agreement is finalized for purpose of managing the challenges of essential services. This matter has been outstanding since 2010. So the agreement says it must be completed within 6 months so that we don't have to deal with these challenges of essential services going forward. So those are some of the issues that are contained in that agreement.
Okay.
So we are proceeding this afternoon. To table this agreement in the formal council processes.
Now, throughout the protest action, your members consistently stated that yours was a fight to defend collective bargaining and quickly arrest that phenomena of unilateralism that you just spoke of now, where they imposed the 3% on you. Do you believe, though, that with this action, you have sent a strong message to government to never again opt for a route of unilateralism? No doubt.
Actually, there is recognition from government that was wrong. It should not have happened. And by the way, it did not just start with the 3%. It started with the reneging from Resolution 1 of 2018, a signed agreement. And it proceeded in 2021 when they imposed a gratuity of 1,000 rand, which did not go to the baseline of the salaries of employees. And then last year, that was a final straw. So this strike has sent a very clear message. That is why we've now agreed that let's go back and sort out those issues, yes.
But there's also been criticism. Yes, you sent a strong message to government, but I'm sure in other quarters you've seen how they've criticized that stoppage of work, particularly in the hospitals. In hindsight, would you have done anything differently given that level of criticism?
Well, look, I don't know what would have done differently. Remember, these workers, especially in the health sector, other workers in 2020 at the height of COVID, when all of us, we locked ourselves behind our doors, they were out there working. They sacrificed their lives, they sacrificed their families' lives, carrying diseases from the taxis, the buses, and from hospital to their families. Some of them perished during that period. And that is the year where government decided not to pay salary increase. They did not even pay any token of appreciation that workers at the time demanded to say, in recognition of the work that we've done, we'll appreciate even a token of appreciation. So this is the anger that has been accumulating. We would not have wanted to see some of the things that happened. They're regrettable, some of the incidents, they were not part of the plan. But I think these workers can't be vilified in the way some people are doing as if they are now enemies of the public when they are responsible for saving the lives of the public. Their daily job is contribution to the betterment of the lives of the community, including saving their lives those in other state departments, ensuring that the essential services or the quality, the public services that are required by this community is delivered. But we are short-staffed, we overextend ourselves. Today, we're sitting with about 165,000 vacancies in the public service. So it's a very stressful environment. Health workers had to defend themselves, had to voice out their anger and their frustration about the conditions in which they operate.
Mr. Mavuso, thank you very much for your time this morning. That was December Mavuso, Nehawu's Deputy General Secretary.